How's everyone doing? Good. All right. I am going to start off with a little bit of a story as well on how I got into this field, because I think it matters to the people in this room. Back 15 years ago, actually, next month, I was working as an undergraduate at the University of California, Davis, Department of Conference Housing. And my role as the manager was to facilitate the groups that wanted to use our facilities during the summer when school was not in session, including our dorms and things like that. And two parents that I was showing around as our clients were representative of the XXYY project. And they were looking to use our facilities that next summer for a conference that they were going to have at UC Davis because a new investigator had come to start up her study at the University of California Davis Mind Institute. And I was interested in genetics and biology, and so I asked more questions. And these parents said, "You definitely need to contact her and try to work with her." So I emailed Dr. Tartaglia as a sophomore in college and started working as her research assistant for several years at that point. And I got to see something really special that really formed the foundation of why I went into the field that I went into and kind of went full circle to now be working back with these X and Y variation conditions again. I got to see that she was able to make a difference, not just for the individual families that she saw that particular day, which was super powerful and important, but also then families that she would never meet through the research that she was doing. And that was super impressive and impactful for me. From there, I went to medical school at the Mayo Clinic, and then since then have gone to the University of Colorado, where I have the privilege of working on the Extraordinary Kids Clinic team as the pediatric endocrinologist there. So that's a little bit about my background and how I am to the position I'm in right now. So thank you. So back to that. So those two parents, those two moms really made an impact for me, and had they not been willing to talk about their son's condition and, to somebody that they probably would never even know was going into medicine at that time, I maybe would not be where I am today. So thank you to them as well. All right, so I'm going to breeze through some different types of research that I've been involved with and that I'm currently involved with right now. And to kind of lay this foundation, I wanted to give you guys an idea of what are different types of research designs out there. So we have this, to start off, we have observational studies. So this is a lot of what you've already heard about today. We are observing different phenotypic features in individuals where we're then reporting on them. We may be comparing them to individuals that don't have that particular condition, and we may be following them over time. On top of that, as far as other than kind of the next step of studies to do, are experimental type studies designs, where we're not just observing, but we're then intervening in some way in their environment and looking at the response in those situations. And then on top of that, the research pyramid, where you have the level of evidence being the highest that is really able to change evidence-based care and how we manage patients, are kind of studies of studies. So they're pulling all of the different evidence and that we have together. So I just want to put this into perspective of where we are in X and Y chromosome variations. So when you do a PubMed search, which is looking at the scientific literature for XYY syndrome over the last 20 years, there have been a total of 83 publications. And you can see where these fit on this kind of clinical research trials pyramid. The large majority are essentially either opinions, which aren't even really research, or case reports. So definitely important to report on individuals, but not necessarily, combined or rigorous research. And so we have a long ways to go to develop the type of research that we're doing for these conditions. So I'm going to start talking about the experimental trials. So randomized controlled, often placebo-controlled clinical trials are kind of the gold standard when you're talking about intervention studies. And what this is the basic schematic of this. You start with a study group or a sample of the population that you want to look at, and you then divide them by a random process into either receiving an intervention or not receiving an intervention, and then you follow them for some time and measure some outcome of importance. In order to pull off a randomized controlled trial, including getting funding for it and having meaningful results at the end, you need a lot of different components to work. One of them is you need a big enough study group to be able to, be able to look at the outcomes that you're interested in. So you need willing participants, all you out there that might be potential participants in research studies, to be willing to participate in those studies. We also need to identify what outcomes are important and what should we be measuring, how should we measure them, and when should we measure them. Those are all very important things that really need to be informed by observational studies so we can understand what outcomes we're trying to capture. And then finally, and probably most importantly for an intervention study, you need to have a compelling intervention that you are going to potentially study. So all of these areas are reasons or limitations of why potentially we haven't gotten to the point of a lot of interventional trials in X and Y chromosome variations. For the most part, to my knowledge anyway, the majority, if not the only interventional trials in X and Y chromosome variations have been androgen therapy in XXY. And the reason is because we have an intervention. So we know that throughout the lifespan here, you can see that individuals with XXY have lower testosterone levels compared to their peers, XY males without XY males without an extra X chromosome. So there is a plausible, like, hey, we know that this is a thing that we see in XXY, and we can treat this. We already have a medicine. We already have testosterone. And so the intervention trials that I've had the privilege of being involved in over the last few years have included looking at androgen replacement treatment in childhood. And this study was done by Dr. Judith Ross, and we've published a lot of these data already, and they're available through the AXYS website. Dr. Tartaglia didn't talk a lot about this, but she did an intervention trial that just completed, and we're currently analyzing these data about looking at testosterone in early puberty, and we have a poster here today and more to come in the future. And then finally, also looking at this critical window in early development in infancy, where boys are having a testosterone surge that we often call the mini puberty period. And I have a poster on this, and we're currently still actively recruiting for this study as well. So this study is testo. I won't go into a huge amount of detail, just to let you know that essentially we are looking at the effects of giving testosterone to infants with XXY who are between 4 to 12 weeks of age at the start of the enrollment of the study. And the outcomes that we're looking at include neurodevelopmental outcomes, as well as body composition, as well as some biomarkers that are important in metabolism. And we're currently recruiting for this study. We pay for travel to Denver as well. It's funded by the NICHD, which is a branch of the NIH. And currently, we are doing very well with enrollment, and we hope to maybe even be done with the study a little bit early. We're planning to enroll 60 babies, and we currently have 35 as of last week. So thank you all for participating if you have. And I think that these types of studies are really important to be able to answer really important questions that parents have and clinicians have as well. But on what can I do, especially these new babies who have a diagnosis really early on? What can I do to improve the profile that my child is at risk for? And this is an important question that they have. So we're hopeful that we'll be able to have answers at the end. Briefly, I'm just going to go over other types of studies that I've been involved in. The observational studies, I did a cross-sectional study, so looked at 30 boys with XXY who are adolescents compared to control boys who did not have XXY, who were matched for the same age and pubertal status and BMI. And we looked at a whole bunch of exercise metabolism features. And so this is one of our results. So this is looking at exercise capacity or fitness level. And essentially you can see here that the controls have higher fitness than the boys with XXY, and all of these controls were sedentary, so they could not be like athletes or exercisers. And so what this tells us is that exercise is actually harder. When everything is put together, your lungs, your heart has to beat, your muscles have to take up the oxygen. That whole process, we can't tell what is slower or different, but we can tell that it's harder to do exercise for these adolescents with XXY on average. And when we looked at some correlates of this, it was strongly correlated with body composition, so their level of fat, and inversely correlated with physical activity. So if they were athletes, this was actually, they could still have normal exercise capacity. So that's one example. Another study that we did with Judith Ross, this is 92 boys with XYY, which is really impressive that she recruited that many adolescents, well, actually kids and adolescents. And we looked at, there's been a lot of the literature that is in XYY is very, very old, as I'm sure you guys know. And some early reports would often refer to the super male or double Y syndrome, or suggest higher testosterone or larger genitalia and things like that. And what we tried to look at whether or not that was actually true. So compared them to control boys of similar age here, as you can see, similar BMI. They were at the same stage in puberty. Their testicular size and penile length was no different. And what we actually found is inhibin B, which is a marker of kind of like fertility or spermatogenesis, does not increase. You can see in the controls here. I don't know if it's going to come across. You can't see. The dashed line is controls, so inhibin B is supposed to increase as you go into puberty, and we're not seeing that in boys with XYY. So this is a cross-sectional study. We need to do a lot more work in this area, but it's very important for kind of destigmifying a lot of the things that have previously been said in the literature. Another study in XXX, so trisomy X, Dr. Tartaglia looked at a clinical sample of patients who were coming and got a marker of fertility or ovarian reserve called AMH. And this is important because there's a lot of reports of infertility in adults with trisomy X, but that's never been looked at in kids, and we really don't understand the process of this at all. And what you can see here is all of the purple dots are girls with trisomy X, and the open circles are normal controls that we got from another study. And all of the girls with trisomy X, you can see, are at or below, for the most part, 1, which is a marker of kind of the lower end of AMH. Another way to look at these data are that 70% had a low AMH level. So again, a lot more work to do in this area, but really important observations. And then finally, I recently received a large data set from PedsNet, which is a collection of children's hospitals in the country that have contributed, that kind of dump all of their medical record data, their EHR data, into a pool. So there's about 5 million children in this record system. And I was able to get the data for all of the X and Y chromosome conditions. And just to give you an example of the numbers, we haven't gotten very far in looking through this yet, but we have 1,100 kids with XXY and about 200 and some for the other trisomy conditions, which are huge numbers when you're talking about these rarer conditions and low ascertainment. And so we're hoping to get some good information, descriptive information about these conditions. So I will end there with just one more plug to have you guys be involved and interested in research. So Dr. Tartaglia and I did a presentation that's available on the AXYS website through the AXYS webinar about learning about research and why it's important and how you can get involved. And there's also research opportunities on the AXYS website, and I'll end there. So thank you.